Hello, hi, I'm Dr. Biju Chapo, consultant pediatrician, St. Joseph Hospital, Dharmapuri.
Hi, I'm Dr. Visma Binoy, Junior Gynec in St. Joseph Hospital, Kothamangalam.
Hi, myself Dr. Sindula Senior, Pediatric Chair in Kothamangalam, Dermatology Hospital. So, Doctor, we are going to talk about childhood obesity.
So, Doctor, I would like to know about what is the prevalence of pediatric obesity in the world today.
Yeah, so that's a very relevant question actually. Now, I will take this as a epidemic. Nowadays, the problem is obesity may be considered as an epidemic malnutrition. If you take all over the world, it's relevant all over across all countries, irrespective of whether it is a developed country or a developing country, it's prevalent all over the world. The problem with the pediatric obesity is that, as you know, the kids are the future of any country. So if you have got obesity in a kid, their lifespan is reduced. They have got multiple issues, starting from cardiac problems, starting from hypertension, diabetes, so multiple issues. So these babies, the productivity will be low, and I can call us a hidden hunger. Hidden hunger means we look at the baby may be obese, but the baby is malnourished, especially malnourished with various minerals and various protein deficiency will be maybe there. But if you look outside, the baby will be obese. So this is a very relevant issue nowadays.
So, sir, what are the complications or problems due to this pediatric obesity?
So, as I said previously, pediatric obesity, obese babies have got multi-dimensional problems. It affects every organ system in their body. If you take brain, they'll be depressed, they'll be anxious, and they'll be withdrawn from the general public because of the obese, since they are obese. If you take the upper airway, they may have a sleep disturbances, they have got asthmatic problems. So, and if you take cardiac problems, I said they are prone for premature atherosclerosis, they are prone for cardiac diseases. And if I take GI problems, they are very prone for diseases like due to obesity, they have got fat accumulation in various parts of the body. So, likewise, if you see, it's a multi-organ dysfunction, and they are very prone for hypothyroidism. So, all sort of issues are there for pediatric obesity.
So, how parents can overcome the complications of obesity?
That's a very relevant question. So, what parents can do is, it's as I said, it's a multi-dimensional issue. So, we have to treat as a multi-system approach should be there for pediatric obesity. Starting from a psychological support, that's very important. The babies may be depressed, maybe because of their obesity. Second issue will be the diet control. That's the most important. Nowadays, in our fast life, all of us are taking food that's not relevant according to the nutrition of the requirement nutrition for the baby. The problem is that they may be taking a lot of fats, a lot of proteins, carbohydrates, but all may not be in a that specific requirement is not met. Especially the micro minerals, vitamin requirements are not met. So it's always better to avoid junk foods and high calorie, high fat, high sugar content food should be definitely avoided. If you take what you call a nutrition plate, it's there. So it's divided into four quarters. So the one quarter is carbohydrate, the other quarter is protein, the other quarter is fat, and third quarter is vegetables. And you got dot. Dot is the milk. So you should have all components of your. If you take a diet, it should be having fat, protein, carbohydrate, and microminerals should be rich in nutrition. So other thing is, I should say, it's more TV viewing, social media influences, because babies trying to take more food if you are influenced by social media and seeing TV, mobiles, so they'll take more. And other thing is, parents should be also counseled, because parents are very much anxious. So they should take according to their requirements. If you see, the babies may be having a specific weight and specific height. So the diet, the calorie they're taking should be according to the height and the age and the weight. So the baby may be having a good height. So the protein requirement and the carbohydrate requirement all should be according to that. And the grandmothers, nowadays grandmothers also are part of taking care of the babies. And grandmothers will be saying, oh, this baby is looking thin, lean. But the weight of the baby and should be that may be appropriate for that age and the height. So you should not force the baby to take more food to get more fat. So counseling the parents and diet control, according to a good dietitian. A pediatrician can definitely help those mothers and parents, and a dietitian help also can be sought forward. So that, and governments, I think government should also do something about it. What government can do is advertisements, social media awareness to the parents regarding the issues regarding obesity. So that's all very important, I think.
So, sir, how can we prevent development of this obesity in children?
That question is quite relevant nowadays. I think the best method to prevent obesity in a newborn starts from the mother. The mother should take appropriate nutrition when she's antenatally, the baby is inside womb. Second, the best thing is breastfeeding. A lot of studies have seen that breastfeeding can prevent obesity both in mothers and also in the babies. That's very more important. So if you exclusively breastfeed a baby till 6 months and continue breastfeeding till 2 years of age, there are a lot of studies telling that future obesity can be prevented. So that's the best method for prevention of obesity in a population. The other methods would be, I would say, the diet control and adequate exercises. Nowadays, the exercise part is very much neglected in the pediatric age group. So that also can help for prevention of obesity. Another thing would be detection of various diseases, especially if you miss hypothyroidism. Hypothyroidism is one of the causes of obesity. So we have actually what we are doing a screening, universal screening of hypothyroidism. So that can also prevent obesity. So we have got a healthy eating plate. That healthy with 4 quarters. The first quarter is the fruits, vegetables, cereals, and proteins. So our diet and got a dot. So dot is the milk. So that our plate should be adequate with carbohydrate, proteins, and microminerals. So if you maintain that plate, our nutrition will be adequate.
Thank you, sir.
Thank you.